Welcome everyone. This is Dr. Jaitly from New York, your cardiologist on MuniMeterHealth, your source for learning cardiology, and of course, your source also for advancing patient education, medical education together to improve the clinical outcomes. So, thank you again for associating with us on MuniMeterHealth to help me advance my global initiative on helping improve human heart awareness, both in health as well as in illness. First things first, I'd like to say number one, this is an educational tool or a format. Two, if you or your someone is having an emergency, please consult your doctor right away. Call for an ambulance or go to the nearest hospital. And three, for my students and residents, I always say that if you have to um, uh, use this as an information for education, primarily consider this as a supplement and not as a text. So please stick to your text and your syllabus that has been advised to you by the universities or your med schools. But the fact is that this is a supplemental information. So now, without any further ado, let's delve into the subject matter. And the matter of the subject today is I'm going to be talking to you about young athletes and their cardiovascular issues that may arise during the course of their sports activities and in their young adulthood. Well, one of the things that commonly is not having a consensus yet in the field of cardiology, in the field of medicine, is which patients to screen for what. We know there are certain places where children of certain moms and dads would have some problems which would be related to, say, they may have accelerated hypertension, which we all know is a high blood pressure. Some of these young kids who are growing up as children, they could be having Marfan or Marfanoid features, and I'm not going to go into the details of what Marfan is, but there's a typical problems with the aorta. There's a typical problem with certain valves where Marfan can manifest very, very early on. So it's a congenital problem. And then there are other issues where one can have hypertrophy of the heart, like a hypertrophic cardiomyopathy, we call, or even left ventricular hypertrophy of a nature. Then there could be aortic valve problems, we call it aortic stenosis, I write it as AS, or mitral valve prolapse, which is somewhat a degeneration of some valve leaflets. Again, it's a congenital issue it's a very prevalent issue, and most of these mitral valve prolapses, they live happily long lives. But the fact is that if they're going to be young athletes with very competitive sports and participating in a lot of physical activity, the chances are that mitral valve prolapse can sometimes lead to certain problems. Then there are other issues called arrhythmias, and these are some of the issues that we come across in young individuals, and specifically so they have EKG problems like a WPW. They could have a Brugada, and these are some of the words. I'm just throwing it out here just so that we understand that should a mom and dad come across an EKG where it has been discussed by the physician, say, look, there's some suggestion of some arrhythmias or some mitral valve prolapse, at least, so the whole idea is wanting to make the patient and the patient's, loved ones, whether it's a guardian, whether it's an uncle, whether it's a mom and dad, whoever's involved in the immediate care of the young adult. It could be an adolescent, 16, 18-year-old, or young kids who have been drafted in national football or national basketball, etc. So all these sports where they go into and they participate in competitive physical, exercise. And, of course, it's a fascinating sport, no question about that. But the fact is that it's also open for many traumatic injuries, and blunt injuries to the chest are very important. So WPW, Brugada, then patients can develop supraventricular tachycardias. Patients can develop ventricular tachycardias. These are very lethal arrhythmias. And then that leads to ventricular fibrillation. Then, of course, unfortunately, death. So there are numerous problems here as we see. Now let's do a schematic here quickly to show you exactly what we are talking about. So here's my favorite schematic that I normally draw for everyone on MuniMeterHealth. Here is the aorta. That's the offshoot that comes off the heart. It gives off two arteries, and one of them just divides rather very early on, and that becomes the LAD and the left circumflex, and this is your right coronary, which again branches off, and all these branches, just like the branches of a tree, will intermingle and they'll supply each other, etc. And so this way the entire heart is nicely supplied. And these are called your coronaries. Now, coronaries can be problem in very young age, because normally we know past the age of 50 people like smokers, hypertensive, diabetics, etc. This is where the clots, the obstructions will develop, like here, for instance, or here. But that's in older age. I'm talking about the young individuals. So there, the coronaries can have anomalies. And what are those anomalies? Well, one of the coronaries could be that it could be arising from a sinus valve, from one of these valves here, and go into the pulmonary artery and get compressed. Or it could be there could be a bridging across here, and that's called tunneling. So we call tunneling of the coronaries. This is tunneling or bridging, if you will. It could be called bridging. Or it could be also, so there's a myocardial bridge. Remember, the heart is like a muscle. So if the heart is like a muscle, when it contracts, the coronaries are on the surface of the heart muscle. So if one of these coronaries is embedded within the muscle wall, that leads to form what it looks like is more like a bridge or a muscle here. And that bridging is abnormal here. So that bridging can compress the coronary, and therefore somebody can have a heart attack in this region or a heart attack in this region, and not only a heart attack, but actually it can lead to death. So these are very, very serious issues, and I think the young moms and dads, obviously, of the children and the adolescents and these young adults, they should really, really be aware. So once you're aware of all these things that are happening, now what gives you a clue that you should go and see a doctor is very important too, right? Because ultimately something has to lead you to go to a physician. Well, it could be a heart murmur. As simple as that. So you have a heart murmur. You may be complaining of some chest pain, which could be, exertional, etc. And that should immediately give you a flag and say, look, I want to go and see a doctor. Or it could be breathing difficulty. We call it shortness of breath. So breathlessness, unusual, especially when it's not explained. It's not asthma, it's not pneumonia, and you're having this breathing difficulty each time you tire out early. Fatigue, for instance. Yeah, you tire out much earlier than the rest of your players, for instance, on the team, etc. So these are some of the areas where you'll just feel that some of these symptoms should lead you to go to see a GP, or your general practitioner doctor. And from there on, I think an ECG is certainly warranted. You can do an EKG. And EKG would look like something, if it's normal, it would look like this, obviously. And here I'm drawing an EKG. Here it would look like this here. So these are your EKGs. But the problem is just an ECG alone is not sufficing. So once the doctor looks at all these clues and say, look, there's a family history of heart murmur, there's a family history of sudden cardiac death maybe, an uncle and aunt, a young family member died, etc. Or there is some history of passing out spells. Now, this is very important. You have syncope, we call it. And syncope implies that you're passing out like somebody passed out in the bathroom or on a toilet seat, or while playing. Specifically somebody passes out while playing a sport. So these are some of the areas where you have to worry about that. All of these symptoms are very, very remarkable, and one has to really take them very, very seriously and bring them to the general practitioner who's going to do an EKG. Later on can decide to do other testings depending upon what the cardiologist, or we'll write it as cardio MD, and a cardio MD can suggest and say, look, you can get an echo, you can get a Holter monitor, which is like a 24-hour monitoring. And so 24-hour Holter, we call it. One can also get a stress test, which is very important. And one can also get other testing depending upon suspicions being high. So you can get an MRA or MRI of the heart, etc., or MRI of the heart, etc. So one can really get, or CTA of the heart as well, to examine these coronaries and these bridges. So there are numerous testings that can be involved, but at least to start with an ECG, echo, 24-hour testing, and a stress test. These are warranted at least by a cardiologist, especially the clues are here so well known. So my whole idea about doing this short video vignette was primarily to see that the young athletes who are participating in, say, in national football games, or they're participating into national basketball games, etc. So all of these can really manifest in one way or the other. Where these young adults have some symptoms, obviously they need to be screened, but we don't know who to screen first. But we have to wait for the clues, or sometimes even pick up a clue maybe at a school nurse level. Like a school nurse will pick up a heart murmur. So even before the physician knows, a nurse can actually refer it to the parents, and the parents will be required to have a clinical examination, a clinical physical examination be entertained first before the person can really join or be recruited to a sports academy or a sports camp. Okay, so this is just a quick, information here for young athletes and their moms and dads and the loved ones, so that we can keep some cardiac issues from happening on the fields. I know there are a lot of great improvements that are happening on the cardiac fields now because the improvement is great. A lot of personnel, a lot of devices are available on the fields as well, like the defibrillators are there. So there is the prognosis is great, even if God forbid if a child passes out or has an event, has a cardiac event on the field. There are good ways to really now resuscitate, but still, unfortunately, these things do happen. But the fact is that we need to prevent all of that, and the only way you can prevent that is by increasing the awareness, and that's our goal at MuniMeter Health. And we want to see that more and more so the patient education, the clinical education, and of course, all of these will determine what the clinical outcomes will be. So we like to see the patient education improve, the clinical education improve, so that we can improve the clinical outcomes in these young athletes, the very young athletes, rather say. Okay, so hope you enjoyed watching MuniMeter Health, and stay tuned because this is the source for your learning cardiology and of course enhancing human heart awareness. Thanks again, and looking forward to meeting you again on MuniMeter Health.